The effects of dementia on the brain.
Dementia is a disorder of the brain. In order to understand this disorder, let's take a look at how the brain works. Everything that we are and everything that we do is controlled by the brain. Each part of the brain has a very special function. For instance, this part of the brain controls how you move your body. This part here causes you to feel pain. Here is the part of the brain that enables you to speak. For memory, many different areas of the brain are needed, but this part of the brain is critical for memory functioning. This front part of the brain controls many aspects of your personality, your ability to control your emotions and your temper. It also enables you to make plans for the future and organize your day. Many times, consumers with dementia disease may puzzle you. Their memory is still fairly good, but their behavior is not. That's because the part of the brain that controls their behavior is dying off faster than the part that controls memory. Every person with dementia will progress differently, depending upon what area of their brain is affected. Some will progress quickly and others slowly. Eventually, brain cell death will consume the entire brain, leading to frailty and death. Alzheimer's disease and vascular dementia. Alzheimer's can be diagnosed while the person is still alive, although a definitive diagnosis cannot be made until the brain is examined after death. Typically, Alzheimer's disease starts slowly and progresses slowly over many years. In Alzheimer's disease, memory is always affected. Short-term memory is the first to go. People will forget what they had for breakfast, but will remember an event that happened 30 years ago. You might find that in the beginning, short-term memory loss may be inconsistent. Sometimes the memory works and sometimes it doesn't. This can be confusing to both caregivers and families alike. But this is how Alzheimer's disease starts. Eventually, social behavior, the ability to communicate, to walk, and to swallow all disappear. Many times you will see another type of dementia in the consumer, a vascular type caused by strokes. A vascular dementia results in a sudden interruption of blood flow to a part of the brain, causing tissue and cell death. Unlike Alzheimer's, vascular dementia or stroke hits quickly, can occur once or many times. So instead of a slow onset and progression of Alzheimer's disease, strokes occur suddenly, with each additional little stroke causing a new change in the consumer's mental and physical ability. Strokes can be massive, resulting in paralysis or loss of ability to speak, or strokes can be small and almost silent in terms of physical effects. Many consumers have both Alzheimer's and vascular dementia. The diseases can progress slowly over many years and then have sudden physical and mental changes due to additional strokes. The consumer's behavior after a stroke depends on what part of the brain the stroke hits. Frontal dementia. A third type of dementia that is commonly seen is called frontal dementia. In this form of dementia, personality and behavior are the first things to change, and memory may go a bit later in the course of the illness. This form of dementia can be confusing to families and to professional caregivers. The consumer may become what we call disinhibited. They may swear, use racial slurs, or have sexual advances that are out of character. Caregivers must understand that these changes are not willful or intentional. They are caused by the disease that has affected the region of the brain that controls these functions. Parkinson's dementia. Parkinson's disease is a brain disorder that causes people to have tremors, muscle stiffness, and move very slowly. Their speech becomes slow and difficult to hear. Some people with Parkinson's disease also develop dementia. These consumers may need extra care because they move so slowly and talk so quietly. Remember, dementia is the loss of memory, but also includes the loss of other brain functions such as judgment, personality, language, motor skills, and how an individual views the world. This disease of the brain is devastating for both consumers and their families. Years ago, this was commonly referred to as hardening of the arteries or senility, but not anymore. We have discussed 4 of the major causes of dementia. There are many others that neurologists can diagnose. Regardless of what disease is causing the dementia, always treat the consumer with dignity and respect. Even if they become physically aggressive or verbally insulting, remember, this is a disease of the brain causing this behavior.